Now is due each week to join Savannah Mayor Van Johnson as he updates the city on the COVID-19 crisis. Let's listen in.
Our associates are battle weary, tired, fatigued at what has seemed to be an endless struggle for the health and prosperity of our city. Nonetheless, we continue to persist. Local data from the Coastal Health District indicates that the virus continues to spread quickly in our community. The number of positive cases in Chatham County continues to increase. In the first 13 days of July, we've had more COVID-19 cases than all of March, April, May, and June combined. Many people argue the numbers are going up because more people are being tested. And as health professionals do more testing, there will naturally be more positive cases, so the numbers would go up. But the factors also tell us that testing is not the only reason there are more cases. Testing does not create new cases. Testing reveals and confirms new cases. Consider the facts, and I'm going to give you a lot of them. In May, we had 266 confirmed cases for the entire month of May. In June, we had 809 cases. To this date in July, we've had more than 1,000 cases, new cases. During the first 7 months of June, we had 45 confirmed cases. During the first 7 days in July, we've had 636 cases. We want you to consider that 2 weeks ago, Chatham County ranked 15 in the state in most cases. Today, Chatham County's ranking has dropped to number 6 for the state's 5th most populated county. 2 weeks ago, the county ranked 130 in cases per 1,000 people. Today, Chatham County ranks 80th. And I think this shows us clearly and convincingly that Chatham County is increasing our positivity rate at a greater rate or faster rate than other areas. Yesterday, the month of July surpassed all of Chatham County's cases in March, April, May, and June, and we still have 17 days left in this month. To date, we have a total number of 50 Team Savannah members infected by COVID-19, 28 police officers, and 7 firefighters. We're also seeing an increase in local hospitalizations from COVID-19. Presently, there are more than 120 people in Chatham County hospitals with the COVID-19 virus. Higher hospitalization numbers tell us that more illness is present in our community, albeit somewhat milder than the earlier variety, but it is still here. High COVID hospitalizations stress our healthcare systems and our healthcare heroes. We've also seen an increase in the percentage of tests that have come back positive for COVID-19. In early June, approximately 4% of tests that the Coastal Health District administered was positive for COVID-19. That number is now around 9.5%. These are the facts. Not politics, not emotions, not perceptions, not opinions. These are facts. The facts that our community is still at great peril, that we are still in the midst of COVID-19, and that at this present moment, things have not gotten better. But to us, even more. These numbers are not statistics. Every single number represents a member of our community, a member of the Savannah family. Every single number represents a mother, a father, a son, a daughter, a grandparent, a friend, a fellow employee. This is and this remains a very serious matter to us. This is why Savannah was the first city in Georgia to mandate the wearing of masks. And as you know, across the state, cities are now following our lead. Last night, our friends in Rome, Georgia, passed their mask ordinance. And that is why we are enforcing this emergency order. To date, our police officers have given out more than 1,000 masks. As I promised, we would make sure that we did all we could to avoid giving citations, because what we really want is compliance. We don't want punishment. But we're to the point where punishments will start having to occur. And that is why we're holding Savannah businesses accountable that are not enforcing this order, first by warning, then by fine, and then by declaration of a public nuisance. This is why we are ensuring that the tours done in and around Savannah are done safely. This is why I have personally insisted that you don't support any business in Savannah that does not care enough about you to protect you by ensuring and insisting that every employee, every patron wears a mask. And that's just me talking. That's why I stand with Dr. Ann Levette and the Savannah-Chatham County Public School System, and I fully support and embrace a thoughtful, delayed approach to a new school year that incorporates a virtual learning environment. There is no way that our public schools can open in person in a little more than 2 weeks and ensure the safety of every student, every teacher, every cafeteria or custodial professional, and every bus driver. Just no way. It's not practical. And the physical upgrades and personnel increases that would be necessary are well beyond the financial capabilities of our school system at this time. In effect, if we were to properly social distance, it would literally take all day to transport our young people to and from school, and the instructional time would be severely diminished if we attempted to open school for in-person classes. To that end, I will be working with our school system, with our city, with Savannah Faith, and with our corporate partners to find ways as a community to bridge gaps and eliminate barriers, to do all we can to make the next coming 9 weeks as productive and as educational as possible for the young people in the city of Savannah, and I'm asking our citizens to do the same. I'm asking for our retired teachers, retired educational professionals. This is an opportunity. If you just adopt one and help them get through the school year, help us get through this 9 weeks. That's Savannah Strong, and that's how we make things happen here. Remember, public education is and remains the public's responsibility. So I thank Dr. Ann Levette, Dr. Joe Buck, and our Savannah-Chatham County Public School System for allowing, for following the science and for putting safety first. And I know that it will be very uncomfortable for a lot of people. And I'm glad that we are announcing earlier rather than later. This is the path that school districts across our state are taking. And so parents and those, we have now several weeks to be able to find alternate ways to ensure that our young people are taken care of. For our businesses, here lies an entrepreneurial opportunity. And we hope that you will see some value and see some creativity during this crisis. The bottom line is this: the virus is still spreading in our city and our county, and we must all do our part to stop the spread. This is not a game. We want you to continue to avoid large gatherings. We want you to wash your hands. We want you to stay home if you're sick, and we want you definitely, absolutely, you must wear a mask. Thank you to all the residents, visitors, and businesses who are following our mandatory mask order and encouraging others to do so. We thank you so much. We know that we pay probably unfair attention to those who are not doing the right thing, but there are so many that are. Thank you. We definitely appreciate you and appreciate your contribution in helping make our communities safe. We have heard complaints from businesses or from some businesses dealing with difficult customers who have a mask but refuse to wear it properly. And let us be very, very clear. The mask ordinance is the correct wearing or the proper wearing of a mask. Wearing a mask means that you're covering your nose and mouth. And I will demonstrate it again. Covering your nose and your mouth. Hanging a mask from your ear, hanging a mask from your wrist, carrying a mask in your pocket or your purse does not mean you're meeting the city's requirement. The point of this order, the simple point, is to slow the spread, not stop the spread. We realize masks don't stop the spread, but we can slow the spread of COVID-19 in our city and keep people from getting sick. If you're not wearing a mask or face covering properly, you're not helping us to do that. Remember, my mask protects you, your mask protects me. And according to the numbers, today, Savannah is in a worse condition now than when we were under the stay-at-home order. We are in a worse condition now than we were when we were under the stay-at-home order. We do not want to go back. But if the science say we must, we will. And if everything gets shut down again, everyone loses. Can we really afford another shutdown? And so for those businesses and for those who want to challenge the wisdom in wearing masks, we're seeing across the country what the alternative is. We're seeing it happen in California. We're seeing it happening in Texas. What happens if we shut down again? Does that really prove your point? In the words of Forrest Gump, that's all I got to say about that. In city news, the Savannah City Council will take our most significant steps to date on our most important endeavor of our administration, hiring a city manager. Today, Mr. Monahan has not changed his mind, so we are continuing to move forward in this process. Right? Okay. We will soon begin discussing specific candidates and embarking upon meeting and interviewing some candidates. This is a highly confidential and sensitive process that must be conducted professionally. My comments about this process will be limited, and I will keep you advised as the law prescribes. And we also have a newly redesigned city website. We want you to check out the new savannahga.gov. It's awesome, it's great, it's phenomenal, it's easy to navigate, it's mobile friendly, so you can find what you need to find quickly, easily, no matter where you are. So go check it out, savannahga.gov. Our Savannah Police Department, partnering with our community, continues to work to make our city safer. Data from our Savannah Police Department shows decreasing violent crime, property crime, and Part 1 crime in our city compared to last year. And again, as a reminder, Part 1 crimes are what we call the deadly sins: murder, manslaughter, sex offenses, robbery, aggravated assault, burglary, motor vehicle theft, and arson. As of July the 4th, there's been a 7% reduction in violent crime, a 22% reduction in property crime, and a 20% reduction in Part 1 crime. It's a start. We can do better. We resolve to do better, but this is a start. And additionally, as many of you know, of the city's efforts to fight blight on the west side, specifically my former district, District 1, and the homes that we had demolished and rebuilt on Cummings Street. I'm so excited to say that the first family moved into the first completed house about 2 weeks ago. This first-time home buyer says that their dream has become a reality, and they cannot wait to see the other positive changes the city has planned for the area. This is what this is all about. Affordable new homes, new families, and breathing new life into streets and sidewalks and communities that were once left for dead. This is how we make Savannah strong, by ensuring that Savannah is affordable for Savannaians. Finally, as I've always said, remember to do your census. Census, my2020census.gov. We have to surpass. I had a meeting yesterday with Representative Buddy Carter and had a subsequent meeting with folks from across the country. And again, talking about funding as it relates to Savannah's position as it relates to receiving federal funds. It all depends on our census numbers, all. So right now, we're about 51%. We can do better, and I'm asking our citizens to please take a moment, take 4 moments, take 10 moments to complete your census, my2020census.gov. Again, 10 minutes will shape our future for the next 10 years. And finally, for real, remember to join us tomorrow as we add another seat to Savannah's table. We look forward to seeing you there. That ends my prepared remarks, and I'll entertain any questions. And Emma or Sean, who's going to be first?
You always go last, so I guess I'll go first.
Okay.
Good morning, Mr. Mayor.
Good morning, ma'am.
My question for you is, we discussed, obviously, the possibility of another shutdown. What do you think it's going to take for Savannah to get to that point of having to do that?
The point at which our medical professionals, our epidemiologists, our partners at the health district and across the country tell us that we're in an untenable situation that will require a shutdown. We resolved from the beginning of this process it was not going to be political. It was not going to be based on feelings. It was going to be based on science. Our friends in Atlanta have reached that point, and so Mayor Bottoms has done what she is legally authorized to do. We're hoping not to get there. But I will tell you that if our numbers continue on that trajectory, I don't see any other course of action.
And is that something you would be able to do without the governor saying, yes, go ahead, or how does that work?
I don't know how it works. Again, we've kept the faith. We'll follow the science. If we choose to do that, we'll do it with all of the medical evidence behind us to support us. We'll obviously hope that the state will take the lead. If not, then we'll do what we think is right.
My last question for you, this might be a question for the health department, but it's been just over a week since we started testing at the Civic Center. What have you heard as far as is that going well? Is it better? Obviously, the conditions are much better for those.
It's going excellent, as a matter of fact. We've been testing thousands of people. They've been lining up early in the morning. Our traffic unit has helped to line them up. We've had help from the National Guard, and we've provided an experience in which is orderly, in which people are able to get in, and more importantly, our healthcare partners are able to administer the test in a cool, more comfortable environment. I think that was really the importance of the city getting involved. I visited a couple of those sites, and it was hot. It was just very, very difficult, and we had healthcare workers that couldn't bear the heat. This is much more comfortable, and again, this is the purpose of having a civic center. This is the People's Center, and that's the point of this. The point of this is really that this is a point where we had space that we could utilize. and we're being good community partners. And so they've been able to test more people. I think several of their highest testing days have been in the Savannah Civic Center. And we are about ready to roll out walk-up testing as well. There are some things we had to work out in terms of logistics for safety purposes. But again, that's what the People's Center is for, to do these types of things. So we're just glad to help, be able to help.
Thank you, Mr. Mayor.
Thank you, ma'am.
Good morning.
Good morning.
So my first question is, we have Dr. Fauci at the national level talking about, some of these surges across the country. And, he is battling back and saying that this is because, these states opened too soon. Now, do you think that here in Georgia we opened too soon?
Oh, I've been on record saying that. I just think it's now a fact. I think it's very clear. Georgia opened up April 24th and April 27th. We had a stay-at-home order that expired the following week. We clearly were on we had not checked any of the boxes for a gradual reopening. I think it's obvious to everyone. We opened too early. And Georgia wasn't the only state that opened too early. But it's really interesting when you look at the states now that are dialing back. The states that are considered the hot spots are also the states that made it a point to open early. And so again, it was my understanding, or would have been my hope, that we would have waited at least until June to be able to do so. Again, that was not within my authority. The state opened up, and we're feeling some of those effects now.
When it comes to the mask mandate, from what I've observed from the outside, it seems like things become more lax as the night goes on, and especially, I guess, in bar scenes and things like that. So have there been any citations at this point, and what does that enforcement process look like?
I'm not familiar with any citations at this point. I am familiar with over 1,000 masks being given away. I think that, part of our issue is very clear. When people see a police officer, they put the mask on. When the officer leaves, some people take them off, which is why it's so important for us to have the business buy-in to help us with that process. Police can only enforce what they see. I do not expect that one of our officers is riding down the street, see somebody without a mask on, they turn on the lights and jump out the car, put a mask on. I don't expect that. But we really have to do this as a community. And bars, clubs, and restaurants, they have some choices in this. They can decide, and I've seen some people, the city says we have to do it, but you really don't have to do it. Well, if we get to the point where we close, we'll all be doing it. And again, as you notice, bars and clubs close first. And so I think it's a question whether they want to be proactive or they want to suffer the consequences of their being lackadaisical about the process.
Good morning.
Good morning, ma'am.
So you mentioned, these new punishments for businesses that don't enforce the mask mandate. Is that something that you've been seeing a lot as far as businesses not enforcing it for no reason?
There is some. We receive, and I receive, complaints. As a matter of fact, I'm calling some corporate offices today. I've sent some folks copies of it because, it might be, and what I'm hearing is corporate office, we support it. And they're saying, we'll talk with our district manager, our local manager. I've walked into some stores. This is real. And we expect that the ordinance is going to be followed. And I think for businesses, the standard is higher because that's where people congregate. And we know it's within businesses where we have a more rapid spread. So, we'll warn you once. We'll write you a citation, and ultimately, you'll be declared a nuisance to this community, and you'll be shut down.
Are those punishments starting today?
Last week.
Okay, and as far as patrolling, are police officers going around, or are they just going and they hear complaints of the business not?
A mixture of both. We want our police officers to address it if they see it. Again, that's over 1,000 interactions. If we took that component out, that would have been over 1,000 citations. So again, our goal here is not to make money. Our goal is not to be punitive. We just want people to wear the doggone mask. Wear the mask, wear it correctly, wear it where you're supposed to wear it. I mean, I can't think it's any, we can make it any easier than that. We are approaching a situation where our community will be shut down again, and then everybody can sit at home and do what they want to do at that point because there'll be nowhere to go. So if you think Savannah is hot, imagine it's hot and you can't have nowhere to go because businesses are closed. And our infections are happening with people working in stores and in businesses. And so the contact tracing is, saying that maybe perhaps, people are affected, customers are affected, co-workers are affected. So, for us, this is serious. This is how it spreads. And we've taken even those protocols here in City Hall.
With that, I know a couple of other local municipalities near us, in their mask mandates have required businesses to post signs outside of their businesses. We're not doing that here, correct?
I believe we have not as of yet, but we might have to make that available. If that makes things if that makes it easier for people to comply, then let's do it. We can figure out a way to make that happen. Anybody else have any questions? All right. Sean, go ahead. Go ahead, Sean. No, go ahead.
All right, thank you, Mr. Mayor. So your counterparts over at County Commission brought this issue up at Friday's commission meeting last Friday of a mask mandate, and considering that the county chair said his interpretation is that, again, the governor's order, nothing can be done beyond that. I guess my question is how, and the county attorney, someone agreed with that, how are there so many different interpretations of what can be done, what can be enforced when it comes to these mask mandates at the local level?
I don't know, to be honest with you. For us, we saw it as an opportunity to be able to support the governor's encouragement and assistance that people in Georgia wear a mask. This is important to the governor of Georgia because he flew around to 5 cities, brought in the Surgeon General of the United States, encouraging people to wear a mask. We believe through our ordinance we are helping, through our order, we are helping that along by mandating masks. I can't speak about the wisdom or judgment of any other municipality or government. And as you all know, I have mad love for Chatham County. Our interpretations are different. I've issued the order. The governor has publicly said that he will not challenge the order. The governor could, if he wanted to, and it's well within his rights, he can issue an order and invalidate every order. The order in Savannah, the order in Hinesville, the order in Atlanta, the order in Athens, the order in Rome, the order in Augusta, the order in East Point. He could do that now. And he said he's chosen not to. And the reason why he's chosen not to is because it follows the science. And so I can only be responsible for Savannah. I would love it. I think it would be great if ultimately the entire of the Chatham County, inclusive of her municipalities, would all be the first county in Georgia to do it consistently. But in the end, I'm not responsible for them. I'm responsible for the folks right here in Savannah. And in Savannah, we're going to do the right thing. We're going to follow the science.
Doesn't make it harder to enforce or encourage when you have all the other municipalities in the county that aren't following that.
That's correct. And again, their residents are going to have to hold them accountable for what they do or don't do. I don't have a role in that, and I've been asked, and I don't have a position on it. That's their business. I'm not getting in their business. But as for Savannah, as for our house, we will, we shall, we must wear a mask.
And last thing for me, you mentioned getting on board with the school system.
Yes.
You have the community partners to come together in this next 9 weeks to help kids as they enter that e-learning process.
Yes.
Get through it. What's that effort going to look like? Who are you going to be reaching out to? I know you mentioned the hire teachers as a possible resource, but we could be looking at another task force for this, bringing all those groups together.
Well, actually, again, our role in this is to help. This is not within our bailiwick. We're not responsible for public education, although it is our responsibility. Dr. Levette and I met yesterday with members of Savannah Faith. And as you remember, this is faith leaders from all over our community. And we really discussed ways that our faith leaders can be helpful to us making these types of things happen. For example, many of these churches, mosques, synagogues have social halls that are not being utilized at this time. If we're able to outfit them with computers, then that might be an opportunity for a child within that neighborhood to be able to go there. And if we have a retired teacher there that's able to help, that helps again to create some opportunities there. We realize that during this time, people, and as I said before, these situations expose every weakness, every vulnerability with our social service system. Some people will do well. There's some people who don't have Wi-Fi. They may not have the technology. And so I'm checking with a couple of community partners to get computers donated, to either upgrade some of our citizens that have computers that won't necessarily support the type of learning environment that we need. And again, provide some of these donations to our houses of faith that are willing to open up their doors, social distancing, of course, to allow for young people to come in there and be able to get their lessons, so to speak. A place for them to come and get their lunch and to get their breakfast. Again, I think that this is a time that a community comes together. And so, Dr. Levette's children are my children. And so we have a responsibility to do all that we can. And as I've told you, the city's intention under my service here will be to be a good community partner. And this time we will be a good community partner. We've done it to the health department. We're going to help with the school system. We're not going to let them go out on that alone. And I think it's important, and I'm just going to add to it, is that, people are upset. And I mean, I get it. I mean, I don't have, as they say, chick nor child. But I get it that it really is inconvenient. It's really hard. It's really, I have to work what I do with my young people. I mean, it's really difficult. But on the other end, we know children are not as susceptible to the virus as adults are. But you think about it. We have 38,000 young people in our public school system. That's 38,000 super spreaders, potentially. 38,000 chances to be able to infect their parents, their grandparents, their aunts, and their uncles. 38,000 chances to infect teachers, custodians, food service workers, bus drivers. 38,000. And so if we don't contain it now, I would hate to have a situation when we open the schools, half the kids are not there because their parents don't think it's safe. Then we get into a situation in which we have to close the schools for an indefinite period of time. I think we can survive for 9 weeks, and if our condition gets better, I would certainly welcome and support reopening the schools as soon as it's safe to do so. Fortunately for us, Dr. Levette, Dr. Buck, and myself, we're following the same science.